All right, welcome everybody. It's good to see some good numbers at this webinar. So I'm Michelle, I'm the Clinical Director at NADA. I've been here about 4 or 5 weeks now, so just settling in. And I just wanted to hand over to Antonia to do a couple of acknowledgements for us.
Thanks, Michelle. I'm Antonia Ravisi. I'm a Program Manager here at NADA, and I look after all clinical areas. I'm just going to start off with an acknowledgement of country. So this morning, I'm just going to acknowledge that we're meeting on the traditional lands of the Aboriginal people all across New South Wales from our various locations. For me, I'm here on the lands of the Gadigal people of the Eora Nation, and they are the traditional custodians of this country. We recognise their continuing connection to land, sky and waters, and we thank them for protecting this land and its ecosystems since time immemorial. We pay our respects to elders past, present and emerging, and extend that respect to all First Nations colleagues who are leaders in their communities here today. We acknowledge the re-traumatisation and the racism that's being experienced by Aboriginal communities during the lead up to and since the referendum, and we accept our role in stepping forward to extend the hand of friendship and support more than ever, and to stand as active allies with our Aboriginal brothers and sisters. We acknowledge that sovereignty was never ceded, always was, always will be Aboriginal land. And here at NADA, we have a recognition statement of people with living and lived experience. NADA proudly recognises people with living and lived experience of alcohol or other drug use, acknowledging their important role in shaping policy, education and services. We acknowledge that through their guidance, diverse experience and peer support, lives are saved and health outcomes are realised. We acknowledge that participation takes courage, gives a voice and reduces stigma and discrimination in our community. Thanks, Michelle.
Thank you. So thank you everyone again for your time today, and we look forward to getting some conversations started out of this. So we're looking at clinical supervision and what that looks like and what effective clinical supervision looks like, but we're also touching on multicultural supervision, Aboriginal cultural supervision and peer worker supervision as well. So we've got some guests here today that Antonia will introduce in a moment. Antonia's already put some of our questions that we'll be looking at in the chat function as well. So if you want to reply to those, feel free as well, and we'll be monitoring that along the way. So hopefully we'll get some ideas from everyone attending today as well, and an idea of what you need from NADA in the future to support this process in your organisations. So I'll hand it over to Antonia just to give you an overview and introduce the panel.
Great. Thanks, Michelle. So I'd just really firstly like to thank you all for joining us. We understand it's a really busy time of year and everyone's getting a little fatigued and tired, so greatly appreciate your time. So I'm just wanting to introduce our panel today, who are here to share their experience. We're very fortunate to have some very experienced clinical supervisors with us. So firstly, I'll introduce Yasmin. And Yasmin has spent 25 years working in the AOD field as a clinician, also as a clinical supervisor, clinical service manager and executive officer. So Yasmin's dedicated her career to working in both culturally diverse and specific services and specialises in providing culturally responsive and safe interventions. Yasmin has a master's in health science with a specialisation in forensic psychiatry and postgraduate qualifications in professional supervision. Over the course of her career, Yasmin has utilised Western education and experience to inform her skill set of working within a negotiated space, which is the space that exists between Western and cultural worldviews and perspectives. Yasmin's committed to representing this negotiated space and to providing insight and awareness on cultural systems and how they can be implemented into mainstream systems. Yasmin's very passionate, and I can vouch for that. We've had some very dynamic conversations in the lead up to preparing for this webinar, and also obviously hoping to extend this project. And is very passionate about instigating systemic change, and is currently working independently and providing external supervision and cultural consultancy services. Thank you, Yasmin, for your time. I'll also introduce Ian. So just a disclaimer here, Ian has actually been my clinical supervisor for probably nearly 10 years, which is a vouch of his patience. Ian is a registered and accredited clinical supervisor. And has been practicing as a therapist since late 1992, so has lots of experience. Ian's worked as a family therapist and a group worker in child protection, domestic and family violence, and in working with people around sexual assault. Ian's got extensive experience in the youth sector as an adolescent and family counsellor, working with young people and family members, and also particularly where there's been alcohol and other drug issues. Ian's taught also for many years at TAFE, delivering the Diploma of Counselling, Diploma of Mental Health, and Diploma of Alcohol and Other Drugs. Ian's therapeutic practice is informed by relational narrative ideas in counselling, family systems theory, strengths-based approaches, and always delivers his work in a trauma-informed framework. Ian's developed lots of specialties, particularly around working with men who've experienced childhood assault and trauma, and has also specialised in sexual and gendered identity issues, grief and loss, relationships, and obviously complex trauma. So we're very fortunate to have Ian here, as he's got a wealth of experience, and he also currently offers clinical supervision to actually some AOD services, including some member services. So thank you, Ian. We also have, unfortunately, apologies from Jen. So Jennifer is our consumer engagement coordinator here at NADA. Jen was to be speaking about peer work supervision. So I will be sharing my slightly limited knowledge in that area. All right, I think you've heard enough from me. So just briefly, before we kick off and start to talk to our guests, we really wanted the webinar to be pretty interactive. So look, obviously we've got some questions that we will put to our panelists here today, but please, if at any stage you want to jump in, make a comment, ask a question, disagree with us, we'd be happy to hear your thoughts. And there'll also be time, obviously, at the end for us to do a bit of a brainstorm around what NADA can do, and also some sort of creative ideas about what we might look at in terms of sharing resources and building up our capacity in the AOD sector to be able to increase the options for supervision for all our members, for all our workers. Okay. So look, I just thought that I would set the scene, and I wanted to do that by actually reading just a really short piece, which comes from some incredibly powerful work by Miriam Rose. And she is an Aboriginal woman who's done a lot of work around encouraging us to be more reflective and to really think about the work that we do, the way that we position ourselves with the people that we work for and with, and the way we position ourselves in the communities that we work with. It's very short, but it's really beautiful, and I think it captures hopefully what we're going to be reflecting on today. It's called Dadiri. It is our most unique gift. It is perhaps the greatest gift that we can give our fellow Australians. In our language, this quality is called Dadiri. It is inner, deep listening and quiet, still awareness. Dadiri recognises the deep spring that is inside us. We call on it and it calls to us. This is the gift that Australia is thirsting for. It is something like what you call contemplation. When I experience Dadiri, I am made whole again. I can sit on the river bank or walk through the trees. Even if someone close to me has passed away, I can find my peace in this silent awareness. There is no need of words. A big part of Dadiri is listening. Obviously, incredibly wise words from an incredibly wise woman. So I'm hoping that sets the tone for what we're talking about in terms of clinical supervision, because it's an opportunity to stop and reflect. Now, let's hear from our fantastic panelists. So I'm going to throw this out to all of you. Can you share with us, what does effective clinical supervision feel like? And I mean feel because really it's that experience that we ideally would walk away from a supervision session actually feeling and possibly thinking about things. Who would like to maybe kick us off? Ian, do you want to start us off?
Okay. Look, I'm glad you actually asked that question, and particularly the word feel, because even with my own supervision and my own supervisor, I've had many conversations about when we're listening to very heavy stories, we will feel the story as a clinician, and we will physically feel the effect of the story on us as well. So I think effective supervision is when we stop and acknowledge what are the feelings we're feeling, and how is our body responding and our mind responding to what we're experiencing and listening to. So it can feel many things. It can actually feel sometimes uncomfortable. I think it's fair to say that supervision is not just about making people feel good. It can be challenging, and particularly when you bring in a reflective component on it, it can be hard work. But when it works well, I see so many light bulb moments go on where people go, "Ah, yes, whole different viewpoint. This feels great," right? And I can relate a story even just last Friday with my intern. He gave me permission to use this. We were having supervision, and he started off with a lot going on, and I said, "It sounds like you've got a lot going on. Are you okay?" He said, "Yeah, I'm okay." He said, "But there is a lot going on." So anyway, we worked through the whole conversation, and at the end, his comment was, "Wow, that was really great. I just feel so much lighter."
Mm.
And I think that's a really good example
Yep.
to offer a lightness for someone to leave a supervision conversation, so
Yeah,
that
that's
you're lighter
beautiful.
physically, and there's more room to think and
Yeah.
feel the work next time round. Yeah.
Yeah, lovely. Thank you, Ian. So some space. Yasmin, would you like to share your thoughts?
I mean, I concur with everything that Ian has said, but would just like to add that for us, or for me, it's about having a connection as well. So when I feel, it's very similar to when you're practicing as a clinician, when you feel a connection to your counselor, or a connection to your supervisor, you're more than likely to have a safe space. And I think when you're creating those safe spaces and there's a connection, and particularly in my case, there's a cultural connection, and people start to feel heard, then you're sort of going into all those feelings of walking away feeling that you're having these effective supervision sessions, no matter what it is, like as Ian mentioned, whether it's a challenging session, whether it's a feel good session, whether it's something they want to talk about in their personal life session that's impacting on their work. So if they have that connection, and you've got that connection with your supervisee, I feel like that's a really good place to start for having effective supervision.
Lovely. Thanks, Yasmin. Thank you very much. That's fantastic. So maybe let's talk a bit about reflective practice, because, with that piece of reading or writing that I shared about Stadiri, it talks about the need to, deep listening. And it makes me think about the idea of reflective practice and what we're endeavouring to do. So Ian, maybe if it's okay to start back with you, what are we actually talking about? What do we mean by reflective practice? And, I guess, how does just stopping and reflecting, how does that change the quality of our work with our clients?
I've seen the difference dramatically if you don't. Like, I think it's stopping is important, but it's also stopping and noticing. And even the practice of noticing noticing what is still physically resonating, noticing what is emotionally present, what's the dialogue that you're still going over with. And you are reflecting anyway, quite often, but there's certain ways of reflecting that can be way more helpful than just re-internalizing self-doubt about yourself as a clinician and a worker. I like to use externalizing ways of having language to assist a person in their reflective practice.
Can you just explain externalizing for us, Anne?
Yeah, sure.
Yeah, maybe give us an example if that's okay.
Well, an example could be, say, if the person is, the worker is even slightly distressed, I'd say what some externalizing questions would be. So this distress you're experiencing, do you recall when this first became, you became aware of it? How did you first experience this this sense of a loss, or this sense of what's going on in this work and what's going on around you that's actually influenced that thinking? Because I look broadly at the context and how that is shaping a person's perception of themselves and their work. So it sees it's not the problem's not in the person; it's actually outside. So and I'd like to talk about the relationship that they might have to this perception of a problem in the work. So it gives a bit more room to explore just the relational dynamic that's going on for a start. Yeah.
Fantastic.
But so I think it's very important to reflect, because we all will come into a work with our own personal stories, our own history. And if we're not reflecting in certain ways, it will slip in. And recently I was supervising someone where it was really obvious that their emotional response of anger toward a young person's parent was actually related to their own anger to their own parent. And if you don't reflect, you don't pick up that. And you need to be able to separate what the old saying, what's yours and what's theirs.
Yeah.
But you can still use that as a resource to reflect on the questions you can bring back into the conversation. Once you've reflected on it, bring it into supervision, then it can change your language that you would use, and even your tone of voice and how you would raise it.
Yeah, great. Thanks, Anne. Yasmin, would you like to share your thoughts on reflective practice and why it's, what does it do to actually enhance our work?
Yeah, just as Ian was speaking, I just wrote down a point that sort of came to mind and touched on, is that, sometimes we don't even realize that we're carrying something. And I mean, I've had this happen a few times recently in my supervision sessions, where there's been a sort of a breakthrough moment, or a bit of a penny drop, and things have occurred to the supervisee that this might be impacting the way that they're feeling, and we've got to the bottom of it. So I think being reflective is so important, and understanding that all these things that happen, I agree with Ian again, not to be the record, but externally, impact, and you've got to have a safe space where you can sort of unpack all those issues. And if I can just sort of touch a little bit on multicultural supervision and talk about that, it involves engaging in dialogue, excuse me, and reflection and learning related to the supervisee's own cultural identities and biases and their professional practice. So it basically, the aim is to increase a self-awareness and knowledge and attitudes and skills related around culture, and that is a very reflective approach in supervision.
Thank you so much, Yasmin.
There is a comment in there so far, just around Ian's perspective. Just sounds excellent, Ian. Using our experiences, our own strengths to reflect on, using our experiences as a resource to inform our practice.
Yeah, lovely. Thank you.
So that's good. So yeah, either put your hand up or just put it in the Q&A.
Absolutely. And thank you for your patience, everybody. Monday morning, gotta love it, don't you? Thank you, Michelle. So we are also wanting to be reflecting and thinking about specialised forms of supervision. And for us here at NADA, it's incredibly important because we're looking at supporting an incredibly diverse workforce, but also a incredibly diverse groups of people that we work with, and to think that really one size fits all just doesn't really cut it. And so for us, we strongly recommend and encourage that we start thinking as a sector about increasing our capacity to provide these specialised forms of supervision, which we'll talk a little bit about in a moment. And so for us, the reference is really about First Nations cultural supervision, multicultural supervision, and obviously peer work supervision, which is different to peer supervision, where a group of colleagues will come together and be, kind of a facilitated discussion amongst themselves. So we'll go into that in a little bit more detail. But again, for us as a sector, starting to think about how can we diversify and provide these specialised forms of supervision, which are actually complementary to I guess, regular supervision, clinical supervision. But I'm going to throw this question out to everybody. So what are the benefits to an organisation? Because obviously we need to recognise that budget constraints and funding can, I guess, get in the way. But really, if we're thinking about the benefits to an organisation and providing clinical supervision and these specialised forms of supervision, can you tell us what have you seen? What do you think are the benefits? Why do we need to be starting to think about this as a sector? Yasmin, maybe would you like to kick us off?
I knew you might ask me. Should stop me if I start going into a rant. I mean, I just talking on the multicultural supervision component. I think that Australia is a highly diverse community, and there are working with culturally and linguistically diverse communities and clients now is really, the not the exception but the expectation. And so most services, whether they are called specific or mainstream, will come across and be working with culturally and linguistically diverse communities or multicultural communities. So I think services that implement cultural supervision or multicultural supervision for both, I don't want to talk out of turn, but both Aboriginal and multicultural communities better equip themselves in terms of their provision of service for both not only their staff, but also the communities and the clients that they work with. So it's really about focusing, building like a strong multicultural workforce, making sure that they do have a space to be supported, allowing them that flexibility and that time to take that support and ensure that they are practicing in a culturally responsive, safe and ethical way. And that's really what it's about. And services that are endorsing that are really kind of moving forward into the future and embracing a multicultural society, and coming out of sort of the very rigid kind of traditional sense of supervision, but also encompassing these, as you've mentioned, Antonio, the three kind of other types of supervision, that one size doesn't fit all. And we said that at the beginning, and we can't just blanket everything across. We need to sort of be looking at these areas and be supporting these specific areas with their very specific needs. So, I mean, I could talk the whole webinar about this, but
that's beautiful. Thank you. Yeah, thank you so much. I guess, Ian, would you say they're complementary? Because, I'm sitting here thinking, okay, so if we're, as an organisation, I don't have a big professional development budget, and I'm kind of thinking about how best to support my staff, but I'm also thinking about the needs of the clients that I'm working with. Like, are we saying that these different types of supervision are like complementary? Would they work against each other? What's your thoughts, Ian, about that?
I think they can be complementary. It would really come down to how you match the the shared approaches, like you'd be wanting to have like similar representations of theory and practice. You wouldn't want a CBT group meeting with a Jungian group, so to speak. You've got to have an underlying similarity in theory and practice for it to be complementary. But certainly they can all line up and add to the supports of staff and workers. And as Yasmin's just said, it's like we don't have one approach to fit everybody. And I think if we can have different approaches in supervision as well, that can also complement. Because I also run an interest group outside of the one-on-one supervisions, and I do 2 workers at one time will come for 2 hours in supervision. So I like to mix it up as a way of doing that, to break also the isolation that workers can feel even in a one-on-one supervision setting. And when we've come together in a small group, it's just been so refreshing for them to share their stories amongst each other, which adds to the support that they feel that they can then take back to their work with clients. So you get better results. I think you get results to stick.
Yeah, nice.
You actually see some better results to stay with the people. Yeah.
Fantastic. So look, we've got a little clip. If people are interested in, we have put together a list of resources which was emailed out, and this particular clip actually is included on that list. Just thought we would like to share with you just some thoughts around particularly First Nations supervision and why that is, I guess, so important. And yeah, I think these people on the clip, and some of you might recognise some of them, really articulate it beautifully. So just bear with me for 1 second, and I will just expand my screen. Lovely. I'm hoping everyone can see that.
Families. The workforce that we train, it is so important for those workers to have some sort of supervision, because, they take on a lot, because this is their history. And we find a lot of the workers really struggle, not only on the cultural side, but on just in their mainstream working.
Supervision is a process of being with a skilled and experienced person who respectfully supports the worker to reflect on their work in a meaningful way, and it's in order for them to learn and grow in the context of living and working within family and community. Is supervision to be used in the event of a crisis? No. Is supervision line management? No. And is supervision a yarn or a debrief? No, it isn't. It's a regular, ongoing practice. Should a manager be present at supervision? No. This is because their role is very different and it's a very different skill set.
The social and emotional well-being of our staff is quite significant, because they're the individual that's providing service to the client. To look after the client, we've got to look after our staff. If we're not looking after our staff, we're not looking after our clients. So the client may be the first person we're concerned with, but we've got to be able to work with the staff so that the staff are feeling good about what they're providing to that client.
In my experience.
Beautiful. And I think they articulate it so well. And I guess the other thing is really important is just to emphasise a few of those key points about when we're talking about clinical supervision, First Nations, cultural supervision, multicultural supervision, peer work supervision. We're not talking line management, and we're talking, an opportunity for workers to come together and have that external support, which is not going to be reported to management or fed back or part of performance, reviews, that it's actually a really safe and nurturing space. Yasmin, sorry,
Tanya, we've just got some comments and a couple of questions.
Fantastic.
In the chat. So somebody's saying they'd really like to see effective clinical supervision built into workplaces from commencement of employment, hours, resources, tools, etc., and access through channels in the workplace, external supervision in other words, from the beginning when someone starts in the particular focus area that they're in, which is a brilliant idea.
Absolutely.
And nowadays, a lot of if you're putting in for extra funding and all that sort of stuff, putting it in tenders is a good idea, because it's sort of like a wraparound support for staff as well. There was also another question which you started getting to, which is around what effective clinical supervision actually is and how it's different from line management supervision. So if you want to have a chat about that, and then I'll go into the next questions.
Beautiful. Maybe Yasmin or Ian, who would like to maybe speak to that? What is the key difference here between line and what we're talking about, clinical supervision?
Well, we've had many chats about this, Antonio, and and making sure that we're really clear on distinguishing the difference. I mean, having been a manager myself in the past, really knowing the difference between providing supervision for a team as a manager and then providing supervision for a team as an external supervisor. And it is, as you've mentioned, it is different. And most of the kind of complementary supervisions outside would need to be provided by an external supervisor, external to the organisation, external to the management team. So this is how the supervisor can feel very supported and in a safe space. Because I keep saying it like a broken record, but that's really what the main aim is to do, is to create safe space. And it's not about checking up in terms of the supervisee's case work and that sense of, and the management, we're not looking with, did you follow a policy? I mean, those sorts of things. It is purely a space for the supervisee to have where they can really put forward any kind of stress issues, anything that they want to talk about, and it not come out and be reported back to the organisation. So I think it's important to make sure that that's distinguished, and that organisations also sort of don't try to sort of kill two birds with one stone, if that makes sense. And I know that cost is always a factor, and a lot of NGOs get by on the smell of an oily rag. I mean, we did it. But I really feel this is why we're doing these sorts of things, these webinars. We are trying to sort of raise awareness about the importance of clinical supervision and the different types of supervision, and how important they are for not only the individual, but also the organisation that they are part of. So it's like, and then the community that organisation works with. So it's kind of like a little bit of a pay it forward. If you do this right, you get that right, then this is the outcome is deemed to be a bit better. So I'll let Ian have a wee bit of an add-on to that if he would like to.
Yeah, just
Sure.
Before you do that sort of led into one of the other questions that was here, and then there's a specific question addressed to Ian. But the question around the resourcing for clinical supervision, someone's asking about, it's been part of managers' roles in drug and alcohol. How have other services dealt with this?
Does someone want to maybe answer that? I mean, I just a quick comment as well from myself. So I'm also a clinical supervisor, and I guess just to follow on from that difference between line supervision and then the external clinical is that a really good clinical supervisor will have very clear agreements with the organisation about the exchange of information, and it will be written into a supervisor's contract, and there will be only certain circumstances that may require information going back to management, and it will always be done with the knowledge and in negotiation with the supervisee. So that's where a very clear, well thought out and regularly reviewed supervision contract is incredibly important. And I'll throw to you, Ian. Do you have some added thoughts on that?
Look, I think it's very important to have that contract and that conversation with the organisation, because you're looking after that relationship as well as the relationship with the supervisee that the organisation's paying you to support. So you're managing both ways. And I thought really, Jasmine, what you said before was a manager cannot take off their manager hat. And even as good as you could be in relation to stimulating reflective work, you still are a manager who will at some stage have to have a difficult conversation with a staff member, which will shift the safety and that sense of security to be able to talk about being vulnerable, or for the fear of being put on your personnel file or thought of in a different way. I was mentioned a little tiny comment to someone's manager about something else when I was doing some training. They jumped on it very quickly and said, "What are you talking about burnout for them?" I said, No. Pull that back. So you've got to be so careful in managing that. And I'm very clear in the beginning of my framework that we're here to what supervision's about, and I'm not here as your operational manager. But certainly you can talk about the effect of some of the operational things, but you have to go back to your manager to discuss what might be a solution or a suggestion, or what you might need to negotiate. That doesn't stay with me. That goes back to your supervisor.
Yeah,
And if there is any unethical behaviour, that's also, I've stated that fairly clearly, that I may have to speak to your manager, but I would let you know about that. We would talk about how that would happen.
Yeah.
Yeah.
And maybe just an add-on to that, because for me, in my experience, is that sometimes workers, where the role is perhaps not clear or where it hasn't been explained properly, or perhaps there's some concerns about workplace culture, that workers can feel concerned that clinical supervision is kind of a bit about finding out what the issues are with your work. Or it's kind of a bit of scrutiny or a way to check up on workers. I've heard that regularly from supervisees who've been very tentative coming into their first couple of sessions for supervision. Could maybe you guys both speak to that?
Do you want me to jump in? Look, there are, as I said, I touched on it a bit before when I was saying you're managing and looking after the relationships that you've got with the managers of the organisation as well as the supervisee. Absolutely, I've had situations where workers have been concerned about it getting back to management, and I've had to assure them that unless it was really serious, like you're going to kill someone or running drugs yourself, well, that's the sort of stuff that I'd have to speak of. But there can also be an element of the conversation that you can say, well, is it worth reflecting on? What's the need to keep talking about management stuff anyway? Because we've also got to remind supervisees, workers, that it's difficult work, and when we're in difficult situations, we can get into the habit of blaming. And when we get into blaming an organisation or blaming this, yes, there's lots of difficulties and systems don't necessarily effectively work. But if we get into overly blaming, we're losing the ability to reflect, and we're losing our curiosity, which is one of the best skills we have in our clinical practice. So, yeah, look, I think it's an ongoing just monitoring how the conversation and the tone of the conversation is going. And is it really what you want to be talking about? Is it the best thing to be talking about? Yeah.
Yasmin, do you want to add to that, or Michelle?
Sorry, I'll just jump in here for the question that was directed to Ian from previously. So it's just saying, are you suggesting a kind of harmonisation to incorporate cultural competency into diverse practitioner base? So that goes back to something you were talking about a bit earlier.
I think I'm clear on the question. Look, I think I am saying there can be a harmonisation between them. We'll have different life experiences opposite us with people all the time. So we have to start bringing things together in a harmonious way, if that's what the person's asking. And I can't quite recall a comment now back that I mentioned. So incorporate cultural competency. Well, yeah, I think we've got to become more culturally competent. We won't be able to mirror the culture because we're not of the culture. But we absolutely have to get better at our ways of consulting. And that's a skill we need. We have to consult more rather than coming in thinking we know it. Because when we know it, we've also lost our curiosity, and we've also stopped reflecting, and we'll get it wrong.
So can we talk a little bit about peer work supervision? Because obviously in our sector, we're having a lot of conversations, and it's an area under incredible development and discussion, and we're looking at, what other states are doing and countries. But obviously, as a component of supporting our peer workforce and thinking about what our developing peer workforce is going to need, and particularly our lived and living experience workers, maybe any of you could speak to this, but what role does peer work supervision have here? And, why do we need to be thinking about it as a foundation of setting up the peer workforce? Maybe Yasmin, would you like to speak to that?
Yeah, I mean, I was just thinking as you were talking, Antonio, it's not too different to what we were talking about in terms of the different types of supervision and the actual importance and the need for them in terms of, the multicultural, the Aboriginal, and the lived experience peer supervision. And I know we had these chats sort of at the end of last week, and just sort of remembering what Jen was kind of saying, and that it's important. The same thing is that, no one brush for all, and that it's important that because it is a developing kind of area, that when we do this, we do it right from the get-go, and so we're not sort of then having to go back and fix everything up and in holes and gaps. And we've got that opportunity to do it right, and it can be done alongside the multicultural component and the Aboriginal cultural supervision, because I still feel like the three of them would be, deserve the same priority in terms of what we're trying to do across the sector and into the workforce, and create those really sort of unique spaces where each kind of each area has a place that they know that they can go to in terms of getting the appropriate support. So I feel like it's not too dissimilar to what we're trying to do with all the other sort of types of supervision, but the importance being that we try to do it right and try to sort of learn and get this done. Get it when we implement it. It needs to be done in a particularly safe way.
Yeah, I love that. So rather than, as we are in our sector, sometimes playing catch up, that because we're at a really crucial development stage, that if any organisations are thinking about employing peer workers or preparing their organisation and looking at their, their organisational readiness, that this needs to be a core component, is looking at how are you going to provide peer work supervision. And I guess we can look to a lot of the work done in the mental health space, because obviously, while the roles will be slightly different in some cases, and there is some, specific nuances, I think that there is lots to learn. We've only got a little bit of time left. So what I'm thinking is that there's two things we wanted to do was
again, Antonio, we've got a few questions.
Yeah, that'd be great.
Chat.
I was thinking we might throw to some questions, and then we might have a bit of a brainstorm about what do you feel that you need in terms of the sector in developing this area? What kind of support? Yep, go for it, Michelle.
So the first one is, does anyone have an example of a clear agreement about what clinical supervision is, like around the confidentiality? So in other words, what a supervision agreement looks like?
I've developed my own, but quite often with organisations that I do supervise for as well, they have developed their own as a part of their own policies and procedures, which clearly outlines what service they want me to provide and the framework around the supervision and how it does not cross over into any operational or performance management issues in particular. And the confidentiality is really also very similar to with a client, the same limits to confidentiality. Yeah.
Yasmin, did you have something you wanted to add? And the other thing just quickly is on the resource sheet is it's a very simple template, a supervisor's agreement template. And there's also a mention of a clinical supervision website that has free resources, which also includes some supervision templates as well. So that's on the resource sheet that also went out. Again, if anyone didn't happen to get it or missed it, happy to resend that. Yasmin, would you like to add anything?
Oh, I mean, not too much, Antonia, just to say that I think Ian's covered it all, and it isn't too dissimilar to sort of, when you go into therapy session with a client, like it's different, but Ian's covered it all, and a good supervision contract will have all those kind of areas and corners covered.
Yeah, great. Any other questions, Michelle?
Yep, so there's one specifically to Yasmin. Wondered if you have any thoughts about intersectionality when considering the cultural perspective you have in terms of parallels or differences.
Yeah, I mean, great question. Thank you. I think that's what multicultural supervision is about. I mean, if I can just, in a very broad sense, if I could just say that I touched on it before, being the primary goal is to increase the self-awareness and knowledge and attitudes and skills related to culture, but also issues are not just culture, but ethnicity, gender, identity, religion, race, all of those things encompassed, thereby improving the quality of care delivered by the professional. And I think that's, when we're looking at these dimensions, what I want to sort of, in a general sense, is a cultural supervision approach looks at a systemic approach. So, and I know I've blabbed on to Antonia a lot about systemic approaches, but I really want to make that important, that it provides a systemic approach across the supervisor and client care plan, as well as culturally relevant therapeutic techniques. So it looks at, consideration of language, cultural migration, resettlement needs, all those things that can be impacting on the individual. And I just sort of wrote something down because as I saw the question, and just to leave my comment with this, and thought it would be a nice way to sort of capture it and just say that through an awareness of intersectionality, we can better acknowledge and ground the differences. And I think that's a very good analogy in terms of it being parallel to multicultural supervision. I hope I've answered that.
Yeah, and that, someone just wanted to say your input, Yaz, is so valuable regarding supervision that is culturally sensitive. Feel this is still in its infancy in our sector. Yeah.
Well, thank you so much.
Thank you very much.
Another one was, can you give us specific peer supervisor resources or recommendations?
Yes. So again, very, very much a developing area, and there is some work being done as well in Victoria, but also Newer is working on developing some frameworks around basically the whole peer workforce and also peer work supervision. So I'm going to say two things. One is there are some resources out, and again on that list we have listed a couple of reference points and websites that you can go to. The other one, briefly, I should mention is very important. Jen has asked me to mention is that we do have a peer worker community of practice for peer workers. So that's one way that, while it's not supervision externally, it's still a form of clinical practice support, which is something that we could offer at the moment. But yes, it's definitely a developing area for resources, and we've got a few listed on that sheet. Do we have another question, Michelle?
No, that's it for now, I think.
Marsha, did you get a chance to ask your question?
I was just wondering if, you're in private practice, how would you go about as a AOD counsellor, how would you go about getting clinical supervision?
Generally in private practice, and maybe the others could answer this, you would, basically you would have to secure your own and pay for it yourself, which is, to be honest, there are some member workers or workers working in member services who are currently actually paying for their own clinical supervision because they feel that it's really crucial to their work. And in terms of accessing them, we're hoping to be able to put a bit of a list together. It is something the ministry are also talking about. Obviously, we can't make recommendations, but we are hoping to collate a bit of a list of people who offer clinical supervision.
That'd be great.
You can also check on like certain websites like PACFA and ACA.
ACA.
They have lists of accredited and recognised supervisors.
Thanks,
and
Ian.
it's really reading through their bio and their details to see if they have the experience that would match what you're looking for in a supervisor. And it's a bit like if you're looking for a counsellor for yourself, it's the same thing. Go in and interview them.
Yeah.
Ask questions, put some time aside, and see what, like what Yasmin was saying, find if you'll have that connection.
Yeah. Because you'd find fairly quickly if there was some rapport between the two of you, and that you felt that you could discuss things rather than feeling like you're being judged or something.
Absolutely.
You know?
A good supervisor will always let you interview them first and make sure you're the right match.
Oh, cool. That's good. Are you still doing that, Ian?
Yes, I am. I'm fairly busy, though, I have to say, Marcy, at the moment.
No, that's okay. That's okay. That's okay. That's all right. No problem.
Do we have any other questions, Michelle? I'm just watching the little clock ticking its little head off, and I thought we should probably use a couple of minutes just to talk about or to throw it open to see. It's feeling to me like this is just the start of the conversation, and that potentially we may need to sort of step up a level and sort of talk further in perhaps more detail. But what do you think if we just, Yasmin, you got some thoughts?
I mean, I know in the last couple of minutes, I was just going to say, sort of, as we're talking about the sort of resources or the lists that might be created to come out of this webinar, or as sort of an after resource or other kind of areas, it's going to be a little bit more difficult for people to find lived experience supervisors, Aboriginal cultural supervisors, and multicultural supervisors, because on a typical mainstream Western list, you will not find them. Yeah. So I feel like this is why NADA and us are having these discussions today, to sort of bring this out into the forefront and maybe, develop a list that does have those specific areas around for the sector to sort of have a look at in case they're wanting to look at those three particular areas. I think that's really important. We start kind of putting it out there as to be inclusive,
Yeah. Great suggestion.
We've
Thanks,
just
Yasmin.
had a couple of comments around continuing the conversation and having, So if anybody has any ideas on how NADA can support you with this, or what sort of information you want in further webinars and that sort of thing, just contact Antonia or myself.
Yep, absolutely. And as I said, it really feels like the beginning of the conversation. It's an area that traditionally we've not been resourced well to do. It's not necessarily been sort of on the radar, but increasingly it's important, and ethically it's important, because we're talking about clinical integrity of all of our organisations and accountability, because once you close that door, you could be doing anything with clients, you could be saying anything, and so it's another way of providing safety for all of our clients. So we're pretty much at time. Thank you so much, everybody, for your time. I really appreciate Monday morning is a big ask. I appreciate everyone's tired. It's getting towards the end of the year. It's been a big year, big few years. Just to finish up, is there any sort of last thoughts that anyone has that they feel that we need to they need to say? No? Okay.
I just wanted to say thank you for the opportunity to providing the platform, NADA, for this, to have these discussions. And I absolutely agree that this is just the beginning, as we have had many chats already, Antonia. We already have ideas of where this could go. So yeah, I'm just so grateful to be part of this webinar. And yeah, just thank you so much for the opportunity to bring some multicultural supervision to the table.
Thank you so much. Ian, anything you want to say?
Look, thank you again as well. It's great to actually start the conversation. We don't have these often enough. The supervision topic just gets either agreed to or not, and shoved as a cost-saving measure to one side. It's just so vitally important. We're going to be asking our workers to be listening to some pretty horrendous stories, and we just need to look after them. It's pretty simple.
Beautiful. Sounds
That's
like a really
perfect way to sum it up, Ian. Thank you.
perfect. Everyone, travel safe, and hope the rest of your day goes well. Thank you again for joining us. We really appreciate it, and we really look forward to seeing you next time. And we'll make sure we get some resources out to you. Thanks again, everyone. Bye.